We offer a BSc Nursing programme which has 2 exit options, a Bachelor of Science in Adult Nursing or a Bachelor of Science in Mental Health Nursing. Along with your degree qualification, successful completion will also gain you professional registration with the Nursing and Midwifery Council, which is the nursing regulatory body in the UK.
This programme would suit anyone who is keen to pursue a career for people and who has an interest in the health and well-being of others. It would also suit those who have an interest in science, how the body works, what happens to the body and mind during illness, and what we as healthcare professionals can do to help. Nursing is a career which requires team working and excellent communication skills, so if you have an interest in people and enjoy working with others, then this could be the course for you. Our students come from a variety of backgrounds. Many are school leavers, but our programme is also suited to those looking for a career change and one which will make use of their previous life experiences and transferable skills.
Nursing students are required to complete 50% of their degree via practice learning and 50% via theory. During theory time, we use a blended learning approach. This includes online lectures and self-directed learning, face-to-face seminars, small group work, clinical skills teaching and simulation. We offer a great variety of learning experiences, both in theory and practice. This breadth of experience enables our students to develop the clinical and critical thinking skills required for their future nursing careers.
As part of our programme, students are required to complete 2,300 hours in clinical practice, which is organised into 8 placements over the 3 years. One of the fantastic things about this programme is that we offer clinical placements throughout the Highlands and Islands. These placements are in a huge variety of clinical specialities and beautiful geographical locations. Whilst on placement, students are supported and assessed by clinical and university staff.
In comparison to other programmes, our nursing cohorts are quite small, which means that we are really able to get to know our students and support them throughout their studies. Our course is student-centred and student-focused. Students were involved in the design of our current programme and contribute to ongoing evaluation of our curriculum. We're also incredibly lucky that both of our campuses in Inverness and Stornoway are situated in beautiful parts of the world. Students can explore the mountains, beaches, forests and cities of the Highlands and Islands in their free time.
On completion of the programme, most of our students proceed directly into nursing roles within the NHS. The entry-level nursing role is a Band 5, with opportunity for career progression through the bands. Whilst the NHS is the most popular employer for our graduates, many of our students also gain employment with third sector and local authority organisations. One of the excellent things about nursing is that your career can be varied and a stepping stone to many other opportunities. You can travel the world with a nursing degree, you can engage with further education and take up advanced nursing roles. Nursing also allows you to develop transferable skills which are valuable in sectors such as politics and business. I'm really passionate about mental health nursing because it is so important for everyone to have or being able to have good mental health. Having good mental health is the foundation that allows people to live a fulfilling and satisfying life and to be able to cope with life and what life can throw at them. And being able to help enable people living with mental illness to engage in their recovery journeys is very rewarding.
Nursing is a profession that requires you to love both people and science. You learn biomedical sciences, anatomy, physiology, pathophysiology and pharmacology, but you also learn how to care for others, how to communicate well and to be a compassionate professional. I always say that being a nurse is a privilege. You meet and care for people from all walks of life, often at the most difficult times in their lives. You walk alongside them, you share their story. Sometimes that story ends in recovery, sometimes it does not, but it is wonderful to have a job that allows you to make a meaningful difference to the lives of others. I have been fortunate to enjoy a varied clinical and academic career and have worked in various adult nursing specialties including infectious diseases, stroke and critical care. I now work primarily in nursing education and my particular interests are stroke nursing, palliative care and simulation-based nurse education.
I spend most of my time teaching, supporting and assessing students. However, as programme lead, I also guide and support colleagues to ensure the smooth delivery of the nursing programme. Prior to my current role in nurse education, I worked clinically as a mental health nurse in areas such as adult mental health, dementia assessment and child and adolescent mental health.
I'm continually inspired by our students and their enthusiasm for nursing. It's incredibly rewarding to share my experience and to contribute to the development of skilled and compassionate future nurses.
I enjoy building capacity and confidence in students so that they can deliver a high standard of evidence-based mental health care and they can engage those living with mental illness in their recovery journeys.